Imagine as a healthcare worker that, you're seeing COVID, you're seeing patients with the symptoms of it, you're working through it in the hospital at the same time thinking, my father is going through this. I can't see him. I can't talk to him. It was agony. I can't describe it any other way. I can remember the date, February 29th. We were starting out with a lot of plans for infection control program for the year, and news was trickling in. I have often said that those first few months, I really don't remember. We just worked, minute to minute, just taking the CDC guidelines and trying to implement a plan. My father, living in Rhode Island's veteran home, was one of the initial 10 veterans that contracted COVID at the end of March. So imagine as a healthcare worker that, you're seeing COVID, you're seeing patients with the symptoms of it, you're working through it in the hospital at the same time thinking, my father is going through this. I can't see him. I can't talk to him. It was agony. I can't describe it any other way. He fought it for 6 weeks and then succumbed to it. I wanted to be part of the movement or the history, if you will. And then when the morning we started the clinic, one of the pharmacists said to me, do you want to give the first vaccine? For me to have the privilege of giving the first one for the hospital, and then I have never in my career seen people more happy to get a vaccine. I said, boy, I wish every day was like this. People were taking pictures with each other and selfies, and oh my goodness, it was the highlight of my nursing career. I've been a nurse for 35 years, and that day was the highlight. It was never a question of taking the vaccine. I just thought, this is a miracle. I was grateful, that science had allowed this to happen as soon as it could. I think back to my dad suffering for 6 weeks, not being able to articulate why he didn't feel well. So I thought if he could suffer through that, this is nothing. 2021 is the year of the nurse, and they have talked so much, especially in this pandemic, about nurses and self-care. So why isn't a vaccine considered part of your self-care? We can't help others if we're ill or not feeling well or not our best selves. I don't think we'll ever underappreciate the normal ever again in our lifetime. We are fortunate enough to have a choice. We can choose to have a vaccine, and I'm hoping that that's what this shot represents.